April 2013 is Autism Awareness Month, and on the last edition of Health Watch, we introduced a very special and unprecedented three-part series on autism spectrum disorder. If I were you, I'd stay tuned. Hello, I'm Terrence Affer-Anderson, and this is Health Watch. So why are we doing a three-part special series on autism? In just 1 year, from March 2012 to March of this year, the Centers for Disease Control and Prevention, the CDC, has had to revise its report on the incidence of autism spectrum disorders in the United States. A 2012 report based on a review of health and education records collected on 8-year-olds across the country concluded that 1 in 88 American children were diagnosed with autism. However, based on a 2011 to 2012 nationwide telephone survey of some 100,000 American parents, that number has increased dramatically to 1 in 50 children in the U.S. That's a major increase of almost 60%. The CDC also reports that more children are being diagnosed with autism spectrum disorders at earlier ages, some as early as 2 and 3 years of age. Still, most children are not diagnosed until after they reach age 4. So what is going on here? To help us figure that out, today we're going to deliver and delve deeper into the parents' experience with autism. My guests today are people who have considerable experience with autism. They are Dr. Eric Madron, a family physician with Bayview Physicians, who is returning after visiting us for the first edition of this three-part special series. Angel Barnhill, the resource director of the Autism Society of Tidewater, and Angel's son, Zayvon Blair. Welcome to Health Watch, guys.
Thank you.
Thank you.
Thank you.
And Zayvon, I'm really anxious to talk with you. Tell me, what grade are you in?
7th.
7th grade?
Yes.
Okay. And what are your favorite subjects in school?
Math.
Math?
Yeah.
I think you're telling me you also like history and,
Yes,
and
history.
science? Your mom tells me that you like to play sports. What kind of sports do you like to play?
Basketballs.
Basketball?
Baseball.
Baseball?
Bowling.
Bowling?
Any kind of sports.
Any kind of sports, but you're not necessarily real fond of football, huh?
No.
Okay. Your mother also tells me that you know that you have autism. What does that mean to you?
And thinking different.
That you think differently.
Yes.
Very good.
Being special.
That you're special.
Yeah.
Yeah, I would certainly say that you're a very special young man. You have a lot of friends?
Yes.
What does having friends mean to you? Why is it important to have friends?
Well, being truthful and helpful together and play together.
Playing together and everything?
Yes.
Okay. So I want to ask your mom a question now. How old was Zayvon? How old is he now? He's 13? Okay. And how old was he when he was diagnosed?
He was diagnosed at the age of 3.
What was it about his behavior that had you concerned?
Well, when he was an infant, we always knew that there was something different about him. One of my grandmothers would always say that he behaved in different manners than some of the other grandchildren that she had seen. And most likely, probably around the age of maybe 12 months, 13 months, he was still not making your, regular babble noises like other babies did.
I'm sorry, at what age was that again?
Around 12, 13 months.
Okay, okay.
And it was a concern for me. He did not crawl like other infants. He did a small scoot, but was not crawling. And usually around 12 months, kids are pulling up on things, trying to, make their first steps, and he was not doing those things. And so that's kind of what was my red flag to go to his general pediatrician to talk to him about, the differences that I have observed.
I want to ask you the same question that I asked 3 of the 4 guests that I had on the show last month. And these are 3 of the 4 guests were parents of children with autism. I'll ask you again that same question. When you received that diagnosis, what was that like to you? Can you recall that moment?
I can actually. Before we actually got the diagnosis, it was just, you know, speech and developmental delay, language delay, and that's what I thought it was. And so then when I did get the diagnosis, I was actually working in the medical field. And the only thing that I had been taught was just very basic information about autism, and I've seen the movie Rain Man. That was all I knew. And so when I got that diagnosis, the doctor was just like, you know, your child has autism. Here's a piece of paper. You can put them in school for special education, and that was it. And so it was kind of one of those shocking moments for me. What do I do now? You know, where do I turn? You know, what am I supposed to do? And so I went from there just to try to collect more information. I can tell you that same night I went and tried to research so many things online, and I just became very overwhelmed.
I can imagine.
You know, I saw so many things about how some kids with autism would never talk, and some kids with autism would go into institutions, and it just kind of broke my heart. I didn't know where to go.
You know, I saw that movie Rain Man myself, and for a lot of people, that was probably their first introduction to autism. But that movie, as good as it was, I think it probably romanticized the experience of being someone being autistic. So when you think of that movie, and then you have the diagnosis for Zayvon, what was that like? The difference in what you saw portrayed in the movie and what you experienced?
Well, in the movie, like I said, I didn't understand completely about autism. All I saw was that this was a gentleman who had very superb skills and remembering different things. But one of the things that I did think back to is how his brother had to take care of him, and how his brother went to get him from that particular institution that he was in, and then to read information about how others, you know, with autism might have to be in an institution. It made me think, well, you know, what happens to my son?
Right. And Dr. Madron, again, your son Ben is going to come and join us for the third edition, this live studio audience, and he's going to play his cello for us. But if you could just tell us again about your own experience, but particularly as a physician, when you received the diagnosis, when your son was diagnosed.
Ben had some significant developmental delays, I think similar to what Angel was describing with Zayvon when he was younger. Ben was very late in terms of crawling, pulling up to stand, and very late to walk. So we were really focused on his motor delays at the time. And I think my wife and I really weren't as tuned in at the time to his deficits in terms of his language development and his social skills development that ultimately became the more important issues as he got older. And we had a pretty extensive evaluation. I mean, going through medical education, I had little to no exposure to learning about autism spectrum disorders in my formal training, both in medical school and in residency. It just wasn't part of the curriculum. And this is as recently as the early 90s. And that's really before the autism epidemic, if you will, kind of got underway by the mid to late 90s. And so it was a really steep learning curve for us.
And so, Angel, you, what was that process like when, you know, the process of getting a diagnosis? What did you do? And I want to, and you're a physician, but I want to come back to you. But let's start here. What was the process? What did you do?
In regards to, like I said before, we were referred to a speech and language pathologist just to do a pretty simple evaluation on his speech, because that was one of the things for me as well. After that, once they started working with him doing speech therapy, they saw that, okay, there are some different things that are going on with your son, and then they actually referred me over to a neurodevelopmental doctor. And at that point is when we did get that diagnosis, when the neurodevelopmental doctor, he actually did a pretty extensive evaluation just to observe him, to look at some of those motor skills and, you know, look at some of the developmental skills that he was doing. He also looked at some of the mannerisms that he had, some of the repetitive things that he was doing. He would line up toys, and he would play with some toys where other kids, you know, the way that other kids wouldn't, or objects that other kids wouldn't play with.
Okay, you like toys?
Yes.
Yeah, I still like toys. So was the process different for you? Was it a similar process getting Ben diagnosed?
Relatively similar. You know, we had speech therapy evaluations. We had a neurodevelopmental evaluation, actually 2 different neurodevelopmental evaluations. I think the biggest difference was that in our case, the autism word actually never came up, at least not till Ben was several years older.
Really?
It actually became, ultimately became pretty apparent to my wife and I that that's what we were dealing with, even though other terms had been used to describe our son by the specialist that he was seeing.
What was that like for you as a physician, you know, not so much second guessing, but, you know, feeling confident that you had a pretty good hold on what was going on with Ben?
You know, I think in retrospect, looking back on it now, I think a lot of physicians maybe aren't very comfortable with the term, aren't sure how parents are going to take it, how they're going to react to it, and so there's a bit of a reluctance, it seems, to use the term in some cases. Even though it's oftentimes it's pretty clear that that's what's going on, and I see that happen in my practice sometimes now. I have patients who come to see me, and they've been evaluated at other facilities, and no one's ever really said that their child has autism, even though the parents have pretty well figured it out by then.
So oftentimes the parents come to some conclusions based on their own research and
Right.
and so forth after, you know, dealing with, because the parents are there with the children all the time, so they can see a lot more than a physician might be able to see in a visit and through an initial assessment. So we talked initially in the first part of this series on a general definition of autism, and we also, of course, as we've done just now, talk a little bit about the symptoms that that led both of you to trying to find out what exactly was going on. But Dr. Madgen, I'm going to get put some symptoms up on the screen here that I got from the CDC, the Centers for Disease Control and Prevention. Their website lists a number of symptoms for autism. So what I'd like to do is to ask you about some of these symptoms as we put this up on the screen.
Sure. I think there's really three major features of an autism spectrum diagnosis. First of all, the patient has to have some sort of deficit in their communication skills. Usually it's a delay in language development, as both Angel and I observed with our children, but there's other more subtle communication disorders in some cases. Secondly, the patient has to have an impairment in their socialization skills, and this is usually with respect to peer interactions. For example, a young child might prefer to play by themselves rather than interacting with other children in their age group. Sometimes patients interact more appropriately with other children outside of their age group or even with adults more effectively than they do with their same age peers. And then the third major characteristic that all patients with an autism spectrum disorder have is, and this actually can be one of two things, either a repetitive stereotypical type behavior, such as hand flapping, spinning, toe walking, pacing, that kind of thing, or an obsessive preoccupation with a particular object or area of interests. As an example, when my son was younger, and I use him as an example in my practice all the time, he had drop-dead obsession with Blue's Clues at a very early age.
Okay.
And,
at a very early age,
yes,
what do you mean?
Exactly. And again, all kids, you know, at that time liked Blue's Clues, but this was really over the top. And you know, the little stuffed blue dog that he carried around with him everywhere. He had a little hat that he would wear, T-shirts and whatever, and it always had to be something that he was wearing that was Blue's Clues. He would flatly deny this now, though.
Well, I will tell you, I'm 62 years old, and I do know who Blue's Clues is. Well, I'm familiar with that show. I'm not going to say why, but so tell me, what is the? You said that sometimes children with autism, they feel more comfortable with children outside of their age group. Why do you think that is?
Well, many patients are, in terms of their social development, are functioning more like a child who's younger than they are chronologically. And so they might interact more appropriately with kids who are younger than them because they're on a more sort of appropriate developmental level than they are with kids in their same age range.
Okay. Angel, when Zevon was diagnosed and you went through that whole process, where did you turn for assistance to help you deal with that diagnosis?
Well, actually, the day after researching all this information and crying my eyes out, I was able to find the Autism Society. And I just jumped right on top of it and said, I'm going to go and see, what's out there. And I met with some families. I actually went into their office and they just gave me some information about when they meet. And I went to one of their meetings and I met with other families. And at that point, I felt like I wasn't alone. I felt like these are other parents here that are experiencing some of the same things that I am. And these parents are telling me that there's hope. And so that's how, I became involved with the Autism Society, just knowing that there were more parents out there that were going through the same thing that I was.
I would imagine that was very important for you to have that support system with other parents, and is that true for both of you, I guess?
And I very almost always recommend that when I have a patient who's being newly diagnosed with autism. Parents need to recognize they're not alone, and there's many other families out there who can be a good source. I give out Angel's name all the time as a resource of information, because you can feel really like the world is on your shoulders, but it really helps to have other parents who've been there to kind of help walk you through at least the initial coping and evaluation and where do I go next.
What kind of services does the Autism Society provide?
The Autism Society, we actually have a resource center. That's one of the biggest services that we provide. And in that resource center, we have 2 computer stations where the families can print out, make, and take material to help with communication with the families. We have family-to-family workshops where the families are able to communicate and learn more information on how to support their loved ones with autism. We also have a lending library there where they can check out books free of charge, because many families, they go on the internet and they're trying to look at all these books, and then what happens is that book wasn't for them, and then they've wasted their money on some material. So we try to encourage our families to come in to check out that material. And then the third component for us is actually within that resource center, we have something that's called an Autism 101. And that's when we actually sit down with the families for an hour, hour and a half who have been newly diagnosed or just new to the Autism Society. And we sit down with them to discuss particular local, state, community resources that may be available. And they walk out with a binder full of material. And, we kind of give them a little checklist of these are some things that you want to take advantage of when you walk out of this door, because we have to cater it to that particular family.
And I found it interesting that you, Vania O'Keefe, and was it Teresa Zano-McMillan?
Yes, our vice president.
All of you are parents with children with autism. Is it uniformly the case? Is it also the case that each of you become involved with the Autism Society based on your own research and your efforts to find assistance?
Yeah, one of the things about the Autism Society is that we're a parent-driven organization, and we're a part of a national organization, and most of those affiliates across the United States are mostly parents who have become involved, and that's how I came involved. Once I seen that these are parents that are out here who want to help me, then in turn, when I got that help that I needed to help my son, I wanted to turn around and do the same thing for other families. And I think that that's pretty much how all of the volunteers and staff are within this organization, is they really have that passion to help other families because they receive that same help.
Tell us about the resource directory that you have.
We have a resource directory that is online, and it has probably over 40 pages. And what it is it's a listing of resources within the Tidewater area. Service providers. There may be dentists that are really good with individuals with autism. There may be particular camps for autism. So any kind of service that may be out there and providers, we get that information into that resource directory so that families can know where to turn. And most of the information, I could tell you, maybe 80% of that information comes from families. They visit a service provider that was really great with their child and they wanted to share that with us. And so that's what we do. We reach out to our families and say, hey, if you know of a resource that's been beneficial to you, let us know, because that can help another family that comes along the path.
What kind of caseload do you guys have? How many?
We are open 3 days a week, and I can tell you that every day that we're open, we have maybe 2 to 3 families that come in to sit down with us for 2 hours. And then we also have a phone line where families call in and ask information, anything from advice on education, on how they should approach different things in regards to special education, advice on, like I said, with service providers, and sometimes they just want to talk to someone on the other end. They don't want to be pushed off to someone else.
And that communication is very important, particularly, again, talking to a parent, another parent that has a child that has autism spectrum disorder.
Oh, particularly. They feel a little bit more comfort that they know that they're speaking to individuals who have walked along those same paths that they may be walking now.
Dr. Madron, I want to ask you a little bit about your practice, but I want to take a moment to comment on your tie. You know, this is the tie has a pattern for the Autism Awareness logo. Is that what it is?
Right. So the puzzle piece has become sort of the symbol of autism, and so particularly a multicolored puzzle. And autism is certainly a puzzle. So this is a tie from the Autism Society of America.
Okay. Now, tell me about your practice. One of the things that we focused on when we met last, we talked about the simple fact that children with autism grow to be adults with autism. And you in your practice, you see both children and adults with autism.
That's correct.
Yeah. How does that experience differ, do you think, for the child versus the adult?
Well, there are often associated medical problems, and maybe this isn't something we've touched on yet, but many patients with autism have certain medical issues that they're dealing with as well. So, for example, gastrointestinal symptoms are extremely common in patients with autism. Well over half of the patients that I see have some sort of chronic gastrointestinal disorder. And so I spend a lot of time addressing those sorts of issues: chronic constipation, chronic diarrhea, gas and bloating, reflux, abdominal pain. And that's true both in children and adults. Sleep disorders are also very common in patients with autism, either trouble falling asleep, trouble staying asleep, or both. Another issue that we spend a lot of time addressing. And these are issues that once they're under control, it tends to improve the patient's level of functioning in other areas. So you can certainly imagine that a patient who is chronically sleep deprived or has chronic abdominal pain with chronic constipation is going to have more difficulty with attention and focus, and even, in fact, with language development. So for both children and adults, we need to focus on what are their core medical issues so that we can maximize their level of functioning in terms of their language and their social skills.
I guess with any kind of situation, when someone is diagnosed earlier, the better the outcome. Does that hold true for autism?
I think in general
as well?
That's true, sure.
So when a child is diagnosed with autism and starts getting some assistive therapy and care, that increases the likelihood of a more positive outcome for an adult.
Right, and this is really actually a very rewarding area of practice because many patients do improve substantially over time, and it's really a joy to work with these families and see their either children or adults from their family develop and progress over time.
And the Autism Society has adult folks with autism
Oh
as
yeah,
well.
we actually serve individuals from the time they're diagnosed all the way up into adulthood. We also do other social activities to have them engaged and just have them participate just like their typical peers would. So I can tell you that you know, once a month, once every other month, we have teenagers, we have adults that come in and we just socialize and, you know, have fun and make them feel like, you know, you are not alone and that your differences don't make you, you know, the outlaw from everyone else. We all should accept everyone for their differences.
But we're putting up the contact information. Well, we just had the contact information for the Autism Society up on the screen, so we won't necessarily ask you that again.
Okay.
And I don't know if we put the contact information up for your group, sir. If you could tell us how folks can reach you at Bayview Physicians.
Right, I'm with Princess Anne Medical Associates. We're at 1925 Glen Mitchell Drive in Virginia Beach. 689-8430.
689-8430. Okay, and I guess we're going to have to close here in just a moment. Do either of you have anything you'd like to add? We have a little bit of time left. Would you like to add anything before we close? Because I'd like to get to this close with Zayvon. Zayvon, you ready to close the show? You want to be a star?
Yeah.
Yeah. What are your favorite things that you like to watch on television? What kind of stuff you like to watch on television?
Any shows?
Any shows? You just like television?
Yes.
Yeah. And what would you think you like to do when you get older, Zayvon?
Well, I might work at McDonald's.
At McDonald's?
Yes.
Because of the food? Is that what it is? You like the food
but
at McDonald's?
yes, I like to cook foods.
Yeah, you mentioned that. What kind of food do you like to cook?
Cheeseburgers, noodles.
Cheeseburgers and noodles, and you cook the noodles all by yourself?
Yes,
Yeah. Why do you like noodles so much?
because I like to make them with recipes with chicken flavor.
You make them following recipes.
Yes, because I use a fork to
Using what? I'm sorry.
stir it with
Okay.
the bowl,
Okay.
and then I eat it. It's good.
Tastes better when you fix it yourself, doesn't it?
Yes,
And why do you like cheeseburgers?
because I like to make it in a grill,
So you make your cheeseburgers as well.
and then I put the cheese in the microwave. I melt them and then eat it.
Okay. Well, we talked earlier about your helping me to close the show. You ready to do that?
Yes.
Okay. Now, what I'm going to do, I got some contact information from your mother and Dr. Madron. I'm going to get some contact information, for the show, how folks can get in touch with me. And as I'm doing that, I want you to come over here and join me, okay?
Okay.
Okay. If you want to see previous editions of Health Watch, you can go to the City of Norfolk website. That's www.norfolk.gov. And you'll see a link for the Norfolk TV. When you click on that link, you'll see a listing of all of the shows that are produced by the Norfolk Neighborhood Network. Okay, Zayvon, are you ready to close the show?
Yes.
Okay. I'm Terrence Haffer Anderson.
And I'm Zavon Blair.
And this is Health Watch.
Health Watch.
Beautiful. Thank you, my man. I appreciate that. Now you're a star. Thank you very much.